Hi, I'm Shashank Bhargava, and you're listening to Three Things, the Indian Express news show. Back in 2018, India launched its flagship healthcare insurance scheme, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana.
भाइयों और बहनों, हमारी सरकार का प्रयास है कि बीमारी कम हो, साथ ही बीमारी पर होने वाला खर्च भी कम हो। इसलिए हम आयुष्मान भारत योजना लेकर आए हैं, जिससे लोगों पर पड़ने वाला बोझ कम हुआ है। अगर किसी गरीब को कभी अस्पताल जाना पड़ा तो ये कार्ड उसकी जेब में 5 लाख रुपए के एटीएम कार्ड का काम करेगा। आप याद रखिए।
The idea behind this ambitious scheme was to provide health insurance to over 10 crore vulnerable families and offering coverage to each of them for up to 5 lakh rupees per year. Now, the scheme is jointly funded by the centre and the states. 60% comes from the centre and 40% comes from the states, though in the northeast and hilly areas, this ratio is 90 to 10. The scheme is cashless and paperless and covers a range of services.
Diagnostics, this is also for outpatient consultation. It also covers significantly hospitalizations for various treatments, high-end treatments, like your stents, your dialysis, neurosurgery and all of that.
That's Indian Express's national health editor, Kaunain Sheriff. And while telling us about the scheme, he explains that at the moment, there are two kinds of people who are eligible for it.
Yeah, so there are two ways to, avail benefits under the scheme. First is a lot of southern states like Tamil Nadu, Kerala, Karnataka already had a state health insurance scheme. So they had a very significant beneficiary database. So these beneficiaries are automatically eligible for the Ayushman Bharat scheme. The second is there is a census, the SEC Socioeconomic census of the 2011 that covers almost 10 to 11 crore families. So this is almost 50 to 60 crore beneficiaries. So these are also eligible for the Ayushman Bharat scheme. And the third one is, which is a very small number, there are some specific occupations that have been eligible, even if you're not part of the state health insurance scheme or if your name does not pop up in the SEC data. So you can still avail this benefit. For example, someone who is an urban rickshaw puller, he's eligible, or someone who is part of a construction worker, he's eligible. So these are the broad categories of classifications for Ayushman Bharat.
And Kaunain, if you are a beneficiary of the scheme, where all can you go to avail its benefits?
So that's the most important part of the scheme. You might be a beneficiary of Uttar Pradesh, but let's assume you travel to Karnataka. You can avail the scheme in Karnataka. So this is how it works. And the data shows now that there is a lot of interstate movement, especially in the big national hospitals like the AIIMS, Safdarjung, where mostly beneficiaries are coming from other states.
He says that under the scheme, 27,000 healthcare facilities have been impaneled. And this includes hospitals with basic specialities and those with super specialities like neurosurgery and cardiology.
Empaneled in the sense, like how you have for beneficiaries, even hospitals need to have certain standards to become part of Ayushman Bharat. Because like I told you, this also provides some of the specialities. General surgery, orthopedics, cancer, cardiology, neurology. In medical terms, these are super specialities. So you need to have certain infrastructure. So not all government hospitals are empaneled under Ayushman Bharat, or not all private hospitals. There are 27,000 hospitals and almost 60% of them are government hospitals and 40% of them are private hospitals.
Right, and it makes sense for private hospitals to be empaneled because in a private hospital, you'll be spending your own money. But in government hospitals, a lot of the treatment is free. But tell our listeners, what are the kind of things one has to pay in a government hospital?
So a lot of people think that government hospitals, especially super specialties, is free. Even if you go to AIIMS and let's assume that you want to get a stent done, or in a neurology department and you want to get a spinal implant done. These are not available for free. They're subsidized for a few patients, but a patient, if even he might be a below poverty line patient, but still he has to pay something. The second aspect is diagnostics is a big chunk of the expenditure, So diagnostics might not be covered there.
For example, if you get an X-ray done or a blood test done.
Yeah, exactly. So there's a long waiting line in government hospitals. But in Ayushman Bharat, in fact, you can go and get it done somewhere else and then get the treatment for subsidized rates, something like a chemotherapy. But if you want to get an MRI or a CT scan done, under Ayushman Bharat, you can get a CT scan done and an MRI done. So a lot of government hospitals, yes, they offer treatments at a very subsidized prices, but not everything is free.
And so through the scheme, the idea has been to substantially decrease out-of-pocket healthcare expenses among the poor and achieve universal health coverage.
When we mean universal health coverage, we mean that a large section of the population should have access to quality healthcare. That is the first thing. That lacks in India, because if you look at the government's own data year-wise, almost 70% of tertiary healthcare, when we talk about hospitals, is with the private sector. So universal access is not a reality in India. So that's the first thing. Second thing is, let's assume that you get access to healthcare. In India, even the middle class pays out-of-pocket expenditure. What it means that you don't have a safety net like a health insurance. So you either borrow from someone or your own savings or your income. So India ranks very high on out-of-pocket expenditure. So if you look at the total health expenditure of India, 60% is out-of-pocket expenditure, which means that every 100 rupees that enters the health sector, 60 rupees is basically out-of-pocket expenditure of, for treatments, for diagnostics, for medicine. So that's a huge number. So Ayushman Bharat was sort of introduced to fix these two problems.
Now, it has been 6 years since the scheme was launched. So the question is, to what extent has it actually benefited people? Who all has it benefited? And what can we learn about 6 years' worth of this data? To find that out, Indian Express filed an RTI and obtained data and documents from the period between 2018 and 2023. And this is what we are dedicating this entire episode to understand. So, has Ayushman Bharat provided universal health coverage and reduced out-of-pocket expenditure?
So, to an extent, it does. The first revelatory part is that almost 54% patient who access treatment through Ayushman Bharat now access that treatment at a private hospital, which is a big change because poor don't have so much resources to access quality treatment in private.
Right. The first thought, if you're not a person of means, is that let's go to the government hospital.
Government hospital, because you don't have the means. That's the first big thing. The second aspect is the government has spent 72,000 crores since its launch. And out of the 72,000 crore, 48,000 crore went to paying the bills at private facilities for the poor. So that is a big chunk. So it shows that in case the scheme was not there, and if poor had to go to private, they had to pay from their own pocket. So it sort of now says that it has significantly reduced the out-of-pocket expenditure. But these are early days. It's like only 6 years of the launch. But yeah, this is the big finding that poor are accessing mostly in private hospitals and government is spending staggering out of every 100 rupees, 70 rupees is now spent in private hospitals. The government is paying those bills.
Okay, so this shows that through the scheme, the poor were able to access private hospitals, which would not have been possible otherwise. But this data also shows that this is actually concentrated in only a few states. So tell us, where all do we see this happening?
So it's startling. I cannot say at this point of time worrisome, but it's hugely concentrated. Like 70% of those who accessed in India are just in 5 states, which is Tamil Nadu, Andhra Pradesh, Uttar Pradesh, Gujarat and Kerala, in private facilities. So it's not like across India, private facilities, it's not like in Bihar, someone is going and accessing it at a very, at ease. It is concentrated here. So here, there could be a big problem because let's assume something like a Bihar not in the top of the list in this, because there is where a significant poor population exists. But it's not at the top there. Tamil Nadu is at top. But Tamil Nadu is already a state which had a robust insurance scheme. And Andhra Pradesh also is a state which already had a very robust health insurance scheme. Kerala, of course, has had a very robust, both government and private.
Right. Tamil Nadu, Kerala, Karnataka, Andhra Pradesh and Telangana together, they have just 17% of Ayushman cards nationwide, but account for a substantial 53% of the total patients in the country. And again, these are all southern states.
Yeah, southern states are doing really well here. So poor are getting access, but which part of the poor are getting access? It's mostly the southern states or states, like Gujarat and Uttar Pradesh.
And Kaunain, what is the reason this is happening? Why is it that the scheme is being utilized more in the south?
So 3 things. First is, like I told you, a lot of states which are doing really good are states which had very good insurance schemes, the southern states. Second is, states which are doing well are those states which have specialities in terms of super specialities that have a wider spread. Something like a cardiology in southern states is doing really well. Cancer is doing really well in Gujarat. So here there is already an infrastructure. So there people poor are able to access it. The third is, why are they doing well? Awareness. States where I think health as a subject, in terms of when we say governance priorities, these are the states which already, if you look at especially Kerala and Tamil Nadu, Karnataka, all of these states, here typically health as a subject, in terms of the priority is very high. So these are states which are already doing well. Uttar Pradesh, where we see here is that for the first time, Uttar Pradesh is doing well, but it will take a little bit more time to understand the impact there because of the density of the population, because they have very high beneficiary data, base, unlike Karnataka and Tamil Nadu. So these are early days, but what we see is, yes, it is hugely concentrated who is accessing this scheme.
And Kaunain, talk about the kind of services that people are accessing through Ayushman Bharat. What are the kind of problems they're using the scheme for?
So at a national landscape, cardiology is the top specialty that is being treated in Ayushman Bharat. What does it tell? It sort of tells India's disease burden, that India needs to sort of ramp up its infrastructure vis-a-vis non-communicable diseases. That there is such a huge burden of diabetes, stroke, heart diseases. The maximum treatment that patient want to access under this scheme is cardiology. It is then followed by general medicine and general surgery. General medicine again is mostly, when you have high blood pressure, when you have issues related to metabolism, all of these. Then what is fascinating is you have other cancer is in the top 5. Cancer, in fact, if you look at the estimates of ICMR, it contributes now to 8% of deaths of India. So cancer is there. And the other big thing is fractures, accidents, fractures. So that is what they're accessing. But then if you look at the state level, it differs. Across all states, of course, general surgery and general medicine is there. But let's assume someone like a Jharkhand or Chhattisgarh. Jharkhand and Chhattisgarh, if you look at government's own data, the screening data that comes out, cancer is such a big burden. Heart disease is such a big burden. But these don't feature in the top 10 of their specialities. The reason being that it's not that the number of patients are there. It's just that they might not have the infrastructure.
Okay, so to understand this better, maybe we can root this into an example. So let's say there's a man, he's from UP, he's a rickshaw puller, he gets into an accident and injures his back. He is eligible for the Ayushman Bharat scheme, and we are trying to figure out where he'll land up, in a private hospital or a public one. Now, firstly, because he's from a northern state, he's from UP, would you say it's much more likely that he won't know about the scheme?
Yeah, of course. Even if he knows of this scheme, if he comes, let's assume, from a rural background, the first place he would go is to a PHC or a district hospital. Mostly in these cases, the district hospitals then refer you to a larger center. If he comes from Western UP, let's assume, or bordering districts of Bihar, they refer to AIIMS. So if you look at AIIMS OPD numbers, if you look at trauma center OPD numbers, AIIMS, mostly these are patients either coming from UP, Jharkhand, Bihar and all of that. So going back to that patient, he will have to be coming to an urban center in his own state. If it's UP, maybe a Kanpur or a Lucknow, or if he is in Western UP, Agra, or the Agra guy referring him again to AIIMS or Safdarjung.
Okay, so within the system, it's much less likely that he'll be referred to a private hospital that is impaneled under the Ayushman Bharat scheme where this person can be treated. So is that just a lack of awareness within the system and the patient himself?
Yeah, so UP didn't have a health insurance scheme prior to. UP, Madhya Pradesh, Bihar didn't have state health insurance scheme prior to Ayushman Bharat.
Okay, so one problem is awareness. But what are the other reasons that a person in North India is much more likely to end up at a government hospital where he'll have to wait for a much longer period? Is the lack of such hospitals also a problem, especially those that offer specialty treatments?
Yeah, we are looking at very large numbers in terms of private access. But are all private hospitals that are empaneled so friendly to treat these patients? Because they can also make a lot of money without health insurance schemes, these hospitals, the larger ones. So if you look at the data nationally, I'm not saying state-wise, some of the big hospital chains are not part of Ayushman Bharat. The smaller ones are, the mid-sized ones are, I don't want to name a big hospital chain in South India does not clock in great numbers in South India. It is empaneled, but it's not at the top. So poor are accessing, but we still don't know, are they accessing at the top hospitals, the likes of Fortis or Apollo, the Max.
And I suppose we also have to question what is the incentive for these hospitals to actively promote and advertise that they are empaneled.
You're right. That's first thing, because they already have a patient load minus the Ayushman. So today the occupancy rate, if you walk into Apollo hospital, will be around 65-75% any day. And if you want to get even a surgery done or radiation done, they are full. So what is the incentive? Because the prices that government negotiate with private hospitals is not as competitive as what is the actual private hospital cost is. So that is why the number is very significant. Still that 54% accessing private hospital is significant.
Okay, so now let's say this rickshaw puller is from a southern state, from Karnataka perhaps. How does his fate change then? And keeping in mind he is still a beneficiary of the Ayushman Bharat scheme.
I mean, there'll be a significant difference down south, which is there in the numbers. Like, if you look at Karnataka, it's exactly the opposite. Karnataka, which has such huge private sector, 80% of the treatment that has happened in Ayushman Bharat is a government hospital. That means that they have facilities in government hospital to give access to treatment. So we have to look at that. And if you look at Kerala, it is not like how we are seeing somewhere in like UP, which is almost 70%. It's not 70s to 30. There it is 40s to 60. Yeah, it's almost 50s to 50. Government, 50 going to government, 50 going to private. So it's not that it's mostly concentrated just in private facilities. So that means government have those facilities. So someone who walk into government facilities can still be treated there. That we don't see in, so that's the first big change. Your second question, will they also be referred to private? Most probably yes, because of the numbers, sheer numbers. And if you look at procedure-wise or specialty-wise, cardiology, some of the pediatric specializations are in the top of the list, which is a super specialization. And dialysis, which is a huge burden in India in terms of cost. If you have a chronic kidney failure, dialysis is a big out-of-pocket expenditure in India. So these are the top there. So yes, in South, there is better utilization of this scheme. And it has to be firstly because it is an institutional mechanism that is in place. So more awareness is the first thing. And since most of the hospitals, if you also look at the spread, since India is significantly rural, so that sort of mirrors that mostly people from rural are accessing.
Okay, so just to take an overview, if this man is from a southern state, it's more likely that he knows about the scheme. It's more likely that when he walks into a government hospital, he'll get facilities that are comparable to a private hospital. And there are more chances that he's referred to a private hospital, which is less likely in the north. But now, Kaunain, tell us, is there a particular social group that is benefiting more from this scheme?
So it's undeniable that since most of the beneficiaries who are, part of the scheme are from the socially economically backward classes. So the SCs, the STs are the ones who have gained the most from the scheme. Now let's look at it from the other way around. If you look at the out-of-pocket expenditure of this group, it's a huge burden, the amount that they spend for hospitalization. If someone is spending around 19,000 an SC or a ST, it's not like the general category is spending something around 1 lakh. It's just 30,000. So the difference is not huge, but the financial burden on this person is very high.
Right, 19,000 for someone who's well off is not that much compared to someone who's just struggling to make his ends meet. For someone like that, 19,000 is huge.
Exactly. Now, this scheme providing them that safety net is massive because here, this is a group who has no access to insurance. Here, if this person has to access, either has to borrow or has to use all its savings to access treatment. So yes, if you look at PM speeches, so he made this first announcement about this big numbers in October last year when we thought of filing an RTA who's getting this whole thing. And if you actually look at his speeches, he makes only 3 points. First, he makes the point that this scheme is to reduce your out-of-pocket expenditure. He gives pure numbers ki, हमने 1 लाख करोड़ आपके बचाए हैं.
अगर आयुष्मान भारत का कार्ड नहीं होता तो इन गरीबों को 1 लाख करोड़ रुपए से ज्यादा खर्च करके बीमारी का उपचार करना पड़ता.
Then he says that it is for serious and critical illnesses. He gives examples of accidents, or he goes to a tribal region and he talks about cancer treatment mil raha aapko. So these are treatments that tribals cannot access. Then he talks about just the marginalized sections, that the enrollment of tribals, in fact the scheme was launched in Jharkhand first. So he gives numbers that these are the, who are benefited the most, the women, the SCs, the SCs. And fourth, of course, politically, he keeps reiterating that this is a scheme for building trust. So that's the political part of it. But yes, your question, of course, it has a huge impact for, the backward castes.
And Kaunain, do we have a sense of just how much out-of-pocket expenditure has been reduced?
No, we don't have that. There is National Health Estimates captures just 1 year of Ayushman Bharat. Right now, we can't really look at it. But what the government's internal health intelligence says that it has reduced the cost by 1 to 1.5 times. Okay, if this person would have gone to a normal hospital. But yeah, now it's almost 5 to 6 years. I think the next National Health Estimates will capture the real impact for 5 years. But at the same time, if you look at the macro picture now of that 1 year, there is a huge reduction, almost to 2 to 3% in out-of-pocket expenditure. And there's a huge increase in social expenditure on health, which includes Ayushman Bharat. So a reduction in something is because of an increase in government's own expenditure on Ayushman Bharat. So that's the first sort of data point that shows us, yes, it is. But looking forward, I think in the next 2 years, we'll get the entire picture about the absolute numbers, how much it has decreased.
And Kaunain, what would you say is the biggest takeaway for you from this data?
The biggest takeaway is that Ayushman Bharat is working, but it is hugely concentrated in few states. Private sector has become a big stakeholder in access for treatment of poor. Again, but in that also, it is hugely concentrated in a few states. Some of the specialities where it can be life-saving, huge out-of-pocket expenditure is at the top of the list. Cardiology is there, dialysis is there. You're seeing orthopedics. But some of the states where we thought that something like a Bihar or a Jharkhand or a Chhattisgarh is where maybe poor would want these specialities, they don't feature in the top of the list. So which means that these are the critical departments which need huge upgradation in these states. And the last part is it sort of gives us a large disease burden landscape of India, Let's assume there was no Ayushman Bharat. These are the specialities or infrastructure that needs to be developed in the government hospitals so that in the future, patients, especially the poor, can have seamless access to treatment at the government facilities itself.
Right, and this correlates to all the recent studies that we have seen, including the recent Lancet report, right?
Yeah, 55% of India now suffers from non-communicable disease. 30% of deaths in India happen because of a cardiovascular issue. This is a big, big issue. We are seeing that now with Ayushman Bharat, that cardiology is a top expenditure for the government. So it means that we need to either enhance our screening or enhance our treatment, or we do both. I'll give you an example. Let's assume a state like UP is seeing a huge cardiology numbers in private hospitals in Ayushman Bharat. It means that the government needs to augment its cardiology in government facilities or enhance maybe its NCD screening in this, so that the real scheme is actually to prevent the disease, and not just look at treatment.
Yeah, it's much better for the person to just not land up at the hospital.
Yeah. So if you look at now, we also have what is called as Ayushman Bharat Wellness Centers. So that is the new aspect of the scheme, which is the preventive aspect. So these are the numbers which provide great insights, fascinating insights to the policymakers now, which was not available. We have ICMR studies, which are mostly estimations, but these are real numbers. We exactly know right now when we actually look at those voluminous data, we know in Karnataka, this is the top disease where poor are accessing, and it's very different from what is happening in Uttar Pradesh, and it's very opposite to what is happening in Gujarat. So every state has its own problems. All of these states have similar problems also. Like I told you, general medicine is a big problem. And some of the states which have on the screening aspects shown a higher disease burden are not even featuring in the treatments. Like Jharkhand, Chhattisgarh don't have cancer or cardio in their top 10 specialities, which means that these facilities need to be upgraded in their states.
You were listening to Three Things by the Indian Express. Today's show was written and produced by me, Shashank Bhargava, and was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can tweet us at Express Podcasts and write to us at podcasts@indianexpress.com.